Okay, and people will start filtering in. I am going to stop the share for this little bit. People can see our smiling faces, but that'll also help me see who's here. And we already have 7 folks in the room with us. And more coming.
People nice and early. That's always good.
Yes. And everybody will be muted as they come in, so if they need to have any comments or anything, they can put those in the chat in the meantime. And sad news as we're starting this, I don't know if you guys saw, Shelley Duvall from The Shining has passed away today.
Oh,
Oh,
wow.
it's good to hear that.
Mm-hmm.
I actually enjoyed her in the movie Popeye when I was a kid. She played a perfect olive oil in that movie.
That was actually my first thought too, was when I think of her, that's the face that I think of, even though I saw The Shining, it's just not the way I remember her. So
Yeah, I think of her in that role with that voice. I can hear it. The minute you said her name, that's all I hear. I won't imitate it and embarrass us on this call.
Thank you,
no.
Ed.
And we are still even getting last minute signups as well. So
Fantastic.
Good.
and I'm hoping that we won't have technical difficulties. We're trying um, our management platform again as our host here. So hopefully everything continues to work properly.
Peter, I think we're all as good as our bandwidth.
Probably so, but
Yeah.
in the past we had a rather tense situation with them because the people couldn't use the link and it was causing a whole bunch of problems. So they asked me to please give them another shot in doing another webinar. So we are doing that again. Just checking the few people in that we have here so far.
I like that watermark that you have on yours, Peter.
Thank you.
The logo. I guess we're so used to Teams that we probably need to upgrade.
Well, honestly, I started these doing different backgrounds when I was working exclusively in Teams during COVID.
Yeah, I
So
can change on Teams easily, but
yeah,
I don't think I can do the same here.
you should be able to. Even with a free account, you can upload a couple of them. See lots of familiar faces today. We are straight up at noon and getting a decent number of people in the room. We've got 15 in so far and continuing to get an influx of people signing up last minute. So I appreciate those that are joining. We'll give it a couple minutes and then we'll go ahead and get started.
We should have some epic music playing right now. Wouldn't that be great?
Well, I'm not quite that good yet. But we'll get there, but I'm not quite that good yet.
Like something from the Superman movie.
Oh, we'd have to do something royalty free.
Yeah,
Well, otherwise, the copyright folks will get you.
indeed.
Okay, well, we're a couple minutes after the top of the hour, so we'll go ahead and get started here. Welcome to the NEMT Today Lunch and Learn webinar series. My name is Peter Hicks. I'm the Executive Director for NEMTAC. Be leading you into today's topic with our friends from Broda. Just off the top, want to give a big thanks to our sustaining sponsors. Without them, it makes NEMTAC very hard to do. iCabby and Z-Trip being our silver sponsors, bronze with Kinetic and Mobility Works, emerald, Wings, MedTrans Go, Route Genie, National Interstate, AMV, Routing Box, CTS, MTM, Motive Care, Ride and Safe, Cardigan General. So thank you guys very much for supporting the work of NEMTAC. Quick congratulations goes out to Call the Car. They are the first organization to renew their accreditation. So they were first out of the box to get their accreditation, and now they've just renewed. So offering them congratulations. Please feel free to reach out to them on social media. You'll see us showing that celebration later today as well. So congratulations to them. Next up, a quick reminder, in September, Transform 2024 will be in Glendale, Arizona. Registrations are open. We have a wide array of speakers this year, including this team here. We'll be there September 8th through 10th at the Renaissance Phoenix Glendale Hotel and Spa. Feel free to visit the website to get signed up. If you have any questions, you can email us at conference@nemtac.co. We'll get you some responses fairly quickly. Just a quick glimpse at our speakers. We have, I want to say it is 36 speakers across the system that'll be joining us for the 2 days. And the last big announcement is that ANSI just approved 2 standards for public comment periods. We'll be putting out levels of service. That's BSR NEMTAC 1001 levels of service for public comment. We had done that last year, and after conversation and public feedback, we decided that we wanted to restructure that standard a little bit so that it was a little more specific and more than a definitions list. So what you'll see is a substantive change, which means we had to put it back out for comment. Also at that time, we'll be putting out BSR 1006 2002X passenger verification in lieu of signatures. And so that is all of us doing what we recognized during COVID, which was a signature really wasn't the best way to verify our passengers. And so it gives us some different options, some different standards for people to reference as they're trying to identify the passengers they're transporting in their NEMT vehicles. Next up, I want to introduce our team from Broda. They're going to share some information with us today. We have Dave DeRoyne and Ed Bandis from the Broda team. I'll let them introduce themselves as they get into their presentation, but definitely glad to introduce the challenging the status quo in NEMT seating. There's got to be a better way. So with that, I'm going to stop sharing my screen and I'll let you guys take over, even turn off my camera because you guys don't need to see my mug as you're talking.
Thanks, Peter.
You're welcome.
Hang on just a second here. Is that working?
I don't have it, Ed.
Okay, hang on just a second here.
We're good.
Very good.
Yep, good to go.
Okay. Dave, if you want to go ahead and start.
Yeah. First off, I'd just like to thank everybody for joining us today. Just a quick feedback and a little background on Broda. Broda is the manufacturer of Traversa. Many of you have seen, but Broda is a manufacturing company that has dealt in the healthcare sector for over 40 years. So our specialty has always been safety, comfort, and reliability in seating. And so that is really where we move forward with. All we did is we took those same ideas and really threw them into what we're doing here with Traversa and found something that is pretty exciting. As many of you know, let me go ahead and introduce myself. Dave DeRoyne, a VP of Sales with Broda, have been here now for about 15 years. Ed Bandis is our National Account Executive who is focusing on Traversa right now. And Ed, it's been about 4 or 5 years, somewhere in there. Yeah, time flies. But very excited that he's been on board and being a part of this. So as we get started, and before we let Ed come on and talk about the specifics of the chair, I just kind of want to set the stage into what we were thinking and just kind of get our mindset into what I think is important that we all realize as we're going in. When we sitting and talking about our chair and talking about attacking the market and seeing how good it is for the people that are actually sitting in the chair, just one phrase really started coming to mind more often than not is, hey, there's got to be a better way. And so as we were thinking through the process of building the chair, designing the chair, we just wanted to come up with something better than what is out there. And certainly you guys are more familiar with that even than I am on my level. But I think what we've done is we just blended that healthcare sector and the needs of an NEMT provider into one. But we live in a world where there's always something better. And people are innovative and people are smart and people use their brains to ask questions like, what if? And what if we did this? And how could we do something else? And it's no different in our world as well. And so that was really the genesis of that. We put up a couple of logos here, but you guys would quickly understand that these are companies that have found ways to do things in a better, more efficient way. Netflix, many of you can remember just going to a video store on a Friday night and hoping the movie you wanted to watch was available. And when it wasn't, then you're put on a waiting list or you've got to come back the next day, to the point where Netflix said, you know what, we're just going to mail these discs to people. They found a better way. Not only did Netflix find that way, they found a better way even past that. They stopped mailing discs and they just made it available to stream. So I can instantaneously pull up whatever movie that they're contracted with at any time of the day, at any time that I want, pause, stop, start. So much better than going and finding those old VHS tapes and hoping that they're on the shelf whenever I get to the store. Apple the same way. I don't know how many of you grew up with a telephone on the wall in the kitchen that had a cord about 500 feet long that generally your sisters just used all the time and wrapped themselves up in it, to the point to now we're walking around with a literal computer and a communication device in our pocket. That's a long step into the world of smartphones, but yeah, there's always a better way. I'll even bring up this. In the past, something like this would not have been as viable as it could be, as it is now. To have 29 attendees that I can see here on the list right now, That's something that we would not have been able to do from a logistics standpoint, to get everybody to travel, to get to a meeting room, to get to a hotel, to have even an hour conference. People have figured that out. There's a better way where we can disseminate information and we can learn rather than just always having to be in one meeting hall together. And we do that through things like Zoom, and we do that through things like Teams, and all the things that we learn how to become very proficient at during 2020. We're all pros now. Always a better way to do that. So that's really where our minds were. It's always thinking of a better way. What we've done is just driven that question into our mind to come up with something, and also ask a million questions to providers and people in the industry just like yourself. So with that being said, know that our focus is there's got to be a better way. I think we found it. And I'll let Ed Bandis talk a little bit more about what we define as a better way in NEMT seating.
Hi, everybody. I'm Ed Bandis. I'm the National Account Executive here at Broda. And one of the things that I'm going to add at the very beginning is I'm going to ask you at any point, please add comments in the chat. Number one, we want to know what you're thinking. Number two, I think we can all learn from this because certainly none of us have every single answer. But I will say this, I don't think I can see the chat when I'm in the sharing mode. So Dave, if you don't mind interrupting, if you hear something or see something that we need to stop and talk about, I think that's, the old Socratic method of learning. It's we all learn from each other by talking through some of these things. So as we move forward, this presentation here, hang on a second, it's about to advance, I think. There we go. I wanted to talk first about the goals for this presentation today. Really what we want to do is review some of the different methods of patient seating and transportation options that we have, many of which you guys are familiar with every single day. We want to talk a little bit about the pros and cons of each and talk about the alternatives. As Dave said, talking about the better way. And as we talk about this, I want to make sure that you guys add some of the pros and cons and have a discussion on some of this. Wait a second, something just appeared. It looks like, hey, I can see the chat. That's fantastic. So if you see me looking over here, that's going to work great. So let's talk about the different methods of patient seating, but let's think about, first of all, and I'm going to add a little bit of color here, the perspective that we have from seating perspective is, think about the analogy of children's seats. Do you remember the days when we had the safety was your mother sticking her arm in front of you as you drove down the road? And that was all the safety that you needed in order to survive, is having your mom's arm in front of you. And then at some point, we started talking about having regulations and children's seats and things like that. And just a second, we're advancing the slide. And we started talking about mandatory protections. We all remember the days pre-seat belts. And we said, man, they're infringing on our rights if they're making us wear seat belts. They're making us put car seats in for kids to keep them safe. And many of us are old enough to remember riding in the hat rack of our sedan or facing backwards in the family truckster, if you guys are old enough to remember that movie reference as well. And slowly, we all started moving towards more regulations in the safety in the way we operate inside of vehicles. And so everybody knows now, in fact, this picture shows the 3 mandated and codified seat systems that we have for children. We have the rear facing, we have the front facing, and we have the booster seats that are all now required by law. And if you don't use them, somebody's going to report you to Child Protective Services or look down upon you for abusing your children. And just 20, 30 years ago, this just didn't exist. It didn't matter. You just put your kid in, strapped them in with a seatbelt or whatever. But what's really interesting is when you talk about the same level of protection for our seniors, many of our seniors have the same cognitive or physical abilities as a lot of the toddlers that we transport right now. And what protections are there other than our own ability to, from a moral perspective, provide that level of safety in the transportation world to them. And so right now, the difference between children and seniors is there's laws for the children. There's no laws or even standard practice for the seniors other than what we know on a day-to-day basis. And so when we talk about the risks that our seniors go through, we're really talking about two different places where they're most at risk. Number one is going to be a motor vehicle crash. And we also know there's the non-crash events that happen. Truthfully, I'm pretty sure none of you guys are crashing your vehicles on a daily basis. And so the risk from a crash really is minute until it actually happens. When do most accidents happen? Most of the accidents are going to happen in the non-collision events. In fact, what was interesting when I was preparing this slideshow is I started looking up some of the studies that were out there in the source documents, and what I found was interesting. 2%, and this is a study that was done in the 90s, 2% of all wheelchair occupants were involved in some kind of accident. That's out of all wheelchair users in this particular study. 35% were injured because of improper or no securement. 15% were injured transferring to or from a motor vehicle, and 6% falling on or off a ramp on the way to or from a vehicle. What's even more interesting to me is 65% of wheelchair accidents that were seen in the emergency room were actually because the occupant was either ejected or tipped over inside of the vehicle. That's 65%. So when you look at how does that happen, how often are patients properly secured? There was a study that showed manual wheelchairs are not properly secured 20% of the time. That's a pretty big number if you think about that. But probably the more, I would say, terrifying number is occupants are not secured properly 88% of the time. Let's break that down a little bit. Failure to apply one or both occupant restraint belts in 65% of the trips was a problem. Failure to apply the shoulder belt accounted for 98% of the improper securement. And then back to that 1 in 5, 20% were not completely secured with tie downs. And when we talk about that, if you dig into this, that's because maybe they secured 2 or 3 of the floor straps. But I think when you look at the number of 88% not secured properly on the occupants, it really comes down to how are they being restrained in a chair? And so, as promised, let's talk about this, but let's talk about this different modes of transportation, but with a little bit of a twist. Let's add this from the patient experience themselves, because I think as operators, everybody knows how to transport folks, how to secure all your devices properly, whether it's a wheelchair, whether it's somebody in an ambulatory setting, whether it's a gurney or anything else. We all know it from our perspective, and we hope that our drivers are well trained and doing everything by the book. But from a passenger's perspective, what is this going to mean? So let's start at the very beginning. Ambulatory rides. This is where I'd really like to see people add to my comments, because I think this is where we can really learn. So for example, if I'm talking about what are the pros of a ride that just requires the patient to sit in an OEM chair in a vehicle, what would I say are the pros? I would start off by saying, number one, car seats and seat belts are the safest way to transport somebody. It's already been tested that way. That's the way the car was built. The whole system of the vehicle was built around protecting the passenger in an OEM seat. Number two, high functioning patient, probably that's the most comfortable way for them to ride in a vehicle if they're able to do that. I would suggest also, as an operator, and even from a patient perspective, it's probably the lowest demand on the driver's time and the driver's attentiveness because the patient's kind of self-sufficient in the vehicle. But this is where I'd like to see, does anybody have any other thoughts on pros for transporting somebody in this method? I'll just take a look at the chat here for just a second. I'd love to see what other people think. We would probably agree that this is the preferred method if you can possibly use it, right? And by the way, Peter, I'm not sure are people able to write
Right
in?
now, they're going through the Q&A at the bottom. The chat's closed, but we've got it handled. I've already been answering some questions, Ed. So
Yeah.
if something pops up, I'll let you know.
Oh, very good. Okay. Very good. All right. So I'm going to go ahead and move on. Let's talk about some of the cons for this kind of a ride. If I'm talking about some of the cons for this kind of a ride, the first thing that I think of is if you have somebody that's less ambulatory or has postural support issues, this may not be the preferred method. Maybe they're not as secure inside of an OEM seat and able to support themselves in this type of a ride. I'd love to hear everybody's thoughts on this. Dave, what do you see coming across there on this?
I'll let you know.
Okay, well, I'll just keep going. I want to hear what other people think.
Well, there's not a lot of feedback right now, Ed, but so just go ahead and keep rolling.
Okay.
Yeah.
Well, I figure these are the guys with all the experience, man. I want to hear exactly what they have to say, and I'm sure everybody else does too. So, okay, I'm going to keep rolling on this, and Dave, stop me. Okay. Now, as we move up the hierarchy of this, let's talk about wheelchair rides, the pros. Obviously, from a pro perspective, it's pretty convenient. Normally, this happens most of the time when the passenger has their own wheelchair. It's convenient. They're going to be loaded into the vehicle. They're going to be taken to some place, taken back out. They have their own transportation with them in the wheelchair. Fairly inexpensive from the perspective of providing care level for them. And it's a standard thing that we've seen, pretty much on a daily basis. Again, if you have any comments on the pros of wheelchair rides, I would love to hear those and share them with everybody. In the meantime, I'm going to go ahead and jump and talk a little bit about the cons, because this is where we really start getting into the meat of what we're talking about here, about a better way. By the way, I found this picture of this gentleman sitting in a vehicle, and I don't see any straps. I don't see him facing forward. He looks like he's just kind of holding on, and that's his whole securement inside that vehicle, which is probably not a good practice. But let's talk about some of the cons of wheelchair rides. Number one, we saw this in the previous slides. The risk of improper securement is huge. I think that when you have a 20% of improper securement for the chair and 88% of improper securement for the passenger in that chair, this is where we really start getting into some of the riskiest type of transportation that we see on a daily basis on the NEMT side. What's really interesting, and I'm going to jump to a little story here. In fact, Dave and I were in Utah a few weeks ago, or a couple of months ago, when an article came out and talked about a person who was being transported in a manual wheelchair by the administrator of a facility, put them in one of the vehicles, did not secure the chair properly or the passenger properly, and literally a couple of blocks away took a left-hand turn. The patient tipped over to the right, hit their head on the ramp on the right side of the vehicle, and killed them before they could be taken to the hospital. And that was something that could have been completely avoided with the proper training of the person who wasn't the regular driver and should probably have been using somebody who does it on a regular basis. So improper securement, probably the number one con that we see in this method of transportation, especially from a patient perspective. Probably also the least comfortable of the types of transportation that we see. Especially, I think we've seen all the examples where we're transporting somebody elderly that has a kyphotic spine, where they're bent over, like this, and they're basically staring at their feet and don't see a horizon as they're driving. That's certainly not a comfortable or an encouraging position to be in. Um, Obviously, it's less safe than an OEM vehicle seat. We also have seen and heard of anecdotally cognitive compliance. If the patient or the passenger is uncomfortable and not fully intact cognitively, I'm sure many of folks has seen them try to get out of their chair, undo their securement, get out, and this requires the driver jumping in on a regular basis, having to resecure the passenger and make sure everybody's safe. Um, those are some of the things that we see from a wheelchair perspective on the con side.
Ed, there was a question up here and I see Dave's typing an answer, but the question was, what are the number of for passengers and chair failures due to secure properly? I'm assuming that's failure to secure properly.
Yeah,
Uh,
in fact, what I can do is, and we can answer this a little bit later, but from the percentage perspective, we know that from retrospective studies, 88% of the time, the patient is not secured in the chair properly, and 20% of the time, the chair itself is not secured properly, which is a pretty high percentage if you think about it. And I think as we move forward and talk about some of the alternative ways to secure folks, how do you make it more obvious, easier, and fail safe in order to secure somebody? Because if you've got somebody secured, we can also assume that they're probably going to be happier as well. So in terms of gross numbers, I guess what we would do is have to back into that from a gross number of trips that are taken on an annual basis in the industry and just assume that that's a huge number of people that are not secured properly when they're riding in wheelchairs like this. I hope that answers the question at least a little bit, but obviously the point being it's an extremely high risk and probably an area of focus for training from the NEMT side, and certainly speaks to some of the accreditation standards that NEMTAC is pushing and advocating for the operators that become certified, is making sure that those drivers are aware of all of these potential risks. So with that, I'm going to go ahead and go further. Next on the hierarchy, go ahead, Peter.
well, I was going to say, I don't know if you can pop up the question there, but Matt Dowse had a pretty lengthy question there.
Let's see.
He's just commenting on some of the regulations that IATR is looking at,
Yep.
including the Traversa in that. So I would suggest anybody that's attending just kind of look through and see kind of what their goals are when it comes to that. And remember, the Traversa is the option, but it's really about the safety of the drivers themselves. And it just so happens that that's the option right now. So that's kind of where he was at. Not a question, just a statement for everyone to see.
Yeah, and in
Exciting though.
I think this is where the cooperation between NEMTAC and IATR is going to be hugely influential in the future. And I have a slide that actually addresses that too, because I think from an IATR perspective, globally, regulatory codifying many of these safety issues, while NEMTAC is the accreditation for the actual operators, I think both of those working hand in hand are going to be hugely influential in the future and the safety of this particular industry. Kind of as I alluded to before, we're in the infancy of this, same place where we were when all of a sudden they started mandating some seat belts and at least some kind of child safety seat. This is where we are in the lifespan of our industry right now, too. So anyway, I hope that answers that for the moment, but I do want to address IATR in just a little bit as well. But in the hierarchy, back to talking about the gurney rides, again, everybody here is experienced in some form or fashion operating a gurney, moving folks. From a pro perspective, is certainly probably more comfortable than the wheelchair option that we were showing before. It can provide visibility for the person riding on the gurney. Certainly having some kind of peace of mind and being calm and encouraged during a ride is being able to see out the windows and some kind of horizon. This may help when you have the gurney positioned like this with a head high. Certainly one of the interesting things that we find is that 90% of the gurney rides in the non-emergency medical transportation world did not have to be a gurney ride. They just could not be a standard wheelchair or OEM seat ride. The gurney was the answer. And again, back to what Dave said, there's got to be a better way. If 90% of these only required a gurney because they couldn't ride in a standard wheelchair, there's got to be a better way. But when you need a gurney, you got to have a gurney. And, again, this is a great place if folks wanted to comment on what do you see some of the conditions that actually do require gurney. We know things like spinal cord injury, some extreme obesity. There's folks that have particular issues in terms of flexibility, being able to move post-operatively on a discharge, et cetera. Those are some of the times that you may actually need a gurney. We just find that in the NEMT world, if it's not an acute transport, then certainly it didn't have to be a gurney. There just wasn't anything else before. So as we move forward, let's talk a little bit about the cons of riding or a stretcher and a gurney. As you can see, this person in this one is probably less comfortable. It's probably a more of an acute ride on this particular thing. But in many cases, when you have to lie flat on your back on a fairly firm surface and take every one of the bounces that a vehicle has to go over on a daily basis, it's probably not as comfortable, obviously, as an OEM chair ride. If you can't see out the windows, it's probably also somewhat scary, especially for somebody who's cognitively impaired. One of the interesting things that we've had NEMT providers tell us in the past is that when you go pick up somebody, let's say in a long-term care facility, and you pick them up in a gurney, it's actually probably a less dignified way to be transported, because immediately it looks like it's an acute type of ride, an emergency ride, when in reality it may just be going to a doctor's office or to dialysis, which happens on a weekly basis. But at the time, there was no other options for doing this, but it could be less dignified. Somebody was joking that maybe when you're going to the doctor's office, people are already starting to divide the things up in your room and you're just going for a doctor's appointment. It also provides a little bit less freedom of movement for the person who's occupying that. Again, please feel free to add into the Q&A if there's anything that you see that stands out as a con for a gurney ride. It's certainly a safe way to travel, but that has some cons as well. Dave, were you about to say something then?
No, I'm good.
Okay. So that gets us to this alternative mode, which was kind of the whole point of this presentation, which is there's got to be a better way. And when we talk about alternative, what does alternative mean? It really, in this case, and the solution that we found for this particular industry is really talking about a hybrid type of solution. Is there a better way? How do we take the cons of each of the different modes of transportation, combine them into the same mode, and help eliminate some of the cons that we see in each of those modes of transportation? And it really comes down to this. How do we help increase the comfort and safety of the passenger in this mode, while at the same time making it a viable business alternative for the operators in this particular industry? And that's what we're attempting to do by talking about an alternative mode of transportation, which is, going to become hopefully a standard at some point in the future. So we picked this little graphic here because it's kind of a great way to instantly show some of the movements that an alternative transportation device can have. So we combine the safety of a gurney with multiple straps for the patient, the ability to have the convenience to load as a gurney, and still have the safety and comfort of a wheelchair that's able to position itself in whatever way is most comfortable for the passenger. as we talked about a little bit earlier, the comfort level when you're in a standard wheelchair, when everybody's at a 90-degree position because of the wheelchair itself, it doesn't have the ability to tilt. It doesn't have the ability to recline or position anybody other than the way it comes. That literally leads straight into compliance, comfort, even reportable incidents that go to CMS that actually hurt everybody's reimbursement and marketability of their services in the future. So this is the solution that we came up with that we're hoping helps set a standard in the NEMT industry and be able to also be a viable alternative for the NEMT operators to operate as a service. And so just to hit a couple of points here, we wanted to make sure that, when we're talking about this type of device, besides the comfort and the safety that are implicit in having a flexible platform for people to ride in, we also talk about the chair itself being what's called WC19. We can certainly have a conversation about what that means, but WC19 essentially means that it's been crash tested with a passenger in it, like a crash test dummy, and found to be a safe mode of restraining the passenger without the chair breaking apart in an accident. The ability to have somebody in a platform that's been crash tested, but also that has a high compliance rate because of the comfort, at the same time, from a business perspective, being able to cut your labor cost per ride in half by being able to operate essentially as a wheelchair. This, we believe, is a viable business alternative for the operators out there. In fact, what's really interesting, Dave and I just had this conversation yesterday, something that we found was very interesting in a conversation discussing what's the difference between this and a gurney. It really came down to this. They're two totally different devices. They have two totally different sets of crash test standards. I can certainly get off in the weeds on the crash test standards of a gurney, which is an SAE standard J3027 versus RESNA, WC19 standards. But I thought, man, what is the real difference when you're transporting somebody? And we found that there's a huge difference when you're moving a patient from, let's say, the bed, the starting or the end point, to the vehicle. We talked about the non-crash incidents that happen. A lot of things happen in that particular space and time. We've all seen the videos of a gurney tipping over, which is why 100% of the time, I haven't met an operator yet that advocates using a gurney with one single operator or attendant. Transporting somebody with a high center of gravity, requiring two people basically laying flat as they're transported out to a vehicle, is very different than being able to load them flat, drop the center of gravity down low, put them in a semi-seated position where the center of gravity keeps them from falling out or tipping over, and being able to operate it with one operator. So I just thought about that space and time where accidents have happened in the transferring and transporting of the patient from the starting or end point to the vehicle. Because again, we get back to the vehicle perspective, crashes just don't happen every day. And it really comes down to securement once you're in the vehicle. It's all this other stuff that we have to worry about. And that's where we think that there's an advantage in a hybrid type of environment like this. So let's talk a little bit about industry developments, which is part of the reason why we're here. IATR, NEMT, TTA. I think we've seen, especially very recently, that the agendas within all of these agencies have been to move towards a safer type of transportation environment, especially in the NEMT world. I think it's especially notable when I see NEMT and IATR participating together in these efforts, both from a regulatory perspective, from a reimbursement perspective, and really hammering out not only best practices and accreditation, But even from the legal perspective, being able to develop some of these policies that become the industry standard, just like seatbelts did, just like car seats did for children, this is where we are. And it's these agencies that are leading that effort in order to make this a safer and more profitable environment for all the operators out there. And when we talk about this, obviously, it's going to require, efforts to help on billing codes, contracts, private pay. A lot of it we're finding, as Dave can attest, is really education. A lot of folks like case managers, discharge planners just don't know that there's another way to do these things. Again, just to kind of back up full circle, there's got to be a better way. And a lot of these discharge planners just don't know that there is a better way. In fact, again, to bring up these little stories that pop into my head as we talk about this, one NEMT providers told us, I think their director of operations or director of safety used to come from the EMT world or EMS, the ambulance world, and said that 90% of their discharges from a hospital requiring a gurney were simply because the patient being discharged did not have their own wheelchair. That's a huge expense on the system when there could have been a better way. Now we're hearing from many of the operators that are using this alternative system that they're actually gaining new business from a lot of the hospitals and brokers and other agencies because they're able to provide a safe and very convenient way, not having to wait for emergency services to provide transportation for a simple discharge, but being able to take a patient who does require something more than a standard wheelchair. This is a great way to carve out a niche business and at the same time help expand best practices among the NEMT world as well. So anyway, that's really what it comes down to is, creating a safer, happier passenger, happier payer sources, making sure that the operators can carve out their niche business and have a competitive advantage in being able to do all of these things. And really utilizing the expertise that's inherent with NEMTAC, IATR, TTA, these agencies that can help everybody in their quest to make a better business model and a safer environment for all of their passengers. So with that, I'm going to start cutting this out. What I wanted to say also is that we're happy to be Diamond sponsors this year. And at any point, if we can answer questions about this hybrid system, we're happy to do that. We certainly have the ability to do demonstrations. We have wonderful financing programs that are available 6 months, same as cash, things that help somebody, an operator, cash flow these type of devices into their practice and make it feasible from a financial perspective. And, we're happy to talk about it anytime you want to. And thank you, Peter, for allowing us to talk about some of these alternative sources. Do I need to stop sharing now?
You're welcome to stop sharing. But yeah, just to answer also the question that was put out there, the recording of this webinar will be available online, will be on our social media and in our learning management platform. We're really pleased to have Broda as a Diamond sponsor and to participate in this webinar. It's been important to us to have that participation from all levels and all sections of the industry. Having you guys as a manufacturer of equipment that's dedicated to passenger safety is huge in our mindset. Kind of the shameless plug, if you look at this year's conference and the exhibitors, we have vehicle manufacturers, we have equipment manufacturers, we have insurance companies, all of these folks that are from the industry that care about passenger safety, passenger access, which is exactly what the feds are telling us as an organization that they're focused on, is essential for us to become more respected and a more professional industry within healthcare, within transportation. And we can have the argument about, are we transportation, are we healthcare all day long? But the whole point is we want safe, easy access passenger transportation. So we definitely appreciate you guys being here and speaking to this. I think WC19 is an important element as we look at passenger safety. And while it's a RESNA standard from a NEMTAC standpoint, as a standard developer, we're looking at how do we reinforce those standards that are best for our passengers. How do we make it so that all boats can rise together and that we highlight the best practices and the best standards within the industry? And Melina, thank you very much. We appreciate you guys being here, and thank you for participating. If there's any questions, we can either do them via the chat, or if people raise their hand, I can allow them to speak as well. So I don't know if there were any last minute questions. It's like there's one from Mike McGann.
Yeah. Are there features of the Traversa that reduce the likelihood of improper securement? And the answer is yes. And in fact, if you look at the Traversa itself, it has 4 points of securement that are actually painted red, so you can't miss it. As you probably know, the WC19 standard means that you can secure it one-handed with a hook on a closed loop system, which is exactly what we have on our WC19 equipped chairs. But probably more importantly, to answer the 88% of passenger securement, we've got this, not only the standard seatbelt that's provided, but we also have a chest harness that is really helps ensure two things. Number one, patient comfort and safety, but also in some cases, postural support for those of the folks that probably need a little bit more help sitting up. And if you use the chest harness, the seatbelt properly, and your 4 tie-down points in a WC18 equipped vehicle, that is pretty much 100% of the securement that needs to happen for the patient. And it's pretty obvious if you don't have those things secured at the time versus trying to gerrymander, a different device, a standard wheelchair, for example. Where are you going to attach the hooks? Where are you going to ratchet down or anything like that? This makes it pretty foolproof. I hope that answers the question, Mike.
Well, not seeing any other questions or comments in here. Let me see if it will let me share one last time. That's not what you want to see. That's probably a little bit better. Probably the wrong screen. But for next month, we have our friends from iCabby that'll be doing a presentation. And it is discovering how to optimize trips with fewer drivers. And that will be the second Thursday of August. And they've got some key takeaways there. So we definitely appreciate them coming up next month, and hope that everybody comes in and joins us for that conversation. With that, we thank everybody for coming. We hope that we will see folks in person in September in Glendale, Arizona at our Transform conference. Broda has a rather extensive footprint at the conference this year. So looking forward to seeing that. A reminder again, the public comment period on standards is exactly for you as the industry to have direct input on the standards that are being passed. Because we can talk about the SAE standard and the RESNA standard, but as the NEMTAC standards pass, they carry the same weight and force for the NEMT industry. So we would like to have you comment, even if you're commenting that you agree. Each one of those comments does have to be adjudicated. It goes back before the advisory committees. It's voted on by the board of directors before it goes to ANSI for the final, yes, you followed the steps you're supposed to do. So please comment, review those standards. They are available, nemtac.co/standards. You can get into the copies, even of the drafts that we're currently working on. You can see kind of where we're at and what we're thinking. And you can feel free to reach out to any of the advisory committees to get some input or give your input into the process. So please do that. We appreciate your comments and your participation, and we will see you guys next month. And thank you, Ed and Dave, for being here today. Any last words?
Thanks everybody for attending. It's good just to get the word out that there are many of us who are focusing on safety, and hopefully it comes in and is a good business opportunity for your business, and we're open at any time to discuss that.
Awesome. Thank you again. Appreciate it, everybody. Have a good day.